everybody, my name's Jason Hakin. I'm a new member of the safeguarding team, and I'm here today with our team lead, Kath Evans, and also with Arvi Sagoo, who's our named nurse for children's safeguarding. What we wanted to do today was to take the opportunity to think about some of the unique challenges that we're all facing really around safeguarding that have been thrown up due to the pandemic and the restrictions that have been associated with it. And I know, Kath, that you often talk about safeguarding during the pandemic as being business as usual. Can you tell us a little bit more about that and what you mean by that?
Yeah, absolutely. Really, although we are in very different times and there are very different risks for families, children and young people, the actual process of safeguarding really remains the same. So our policies remain unaltered, our expectations of you remain the same, so we've still got the same statutory duties that we've ever had. And actually making referrals both for safeguarding and for early help remain the same. So it is business as normal. The only thing that's changed is the circumstances in which we're working. So an example of that is us in the safeguarding team. We're all working from home, as you can see by my background, but that doesn't change anything really. You can still get hold of us in exactly the same way through our advice and duty or through email, and we are conducting lots of meetings online through Teams. So stay in touch, we're open for business.
Great. And Arvi, I know that you were going to talk about Think Family.
That's right. Yeah, we know that many of our families are experiencing huge pressures socially, financially, since the lockdown measures were introduced. Direct face-to-face support from agencies for many of our most vulnerable families has stopped. Most children are unable to attend early year settings or go to school. People with existing mental health issues are facing increased pressures, and others are experiencing social isolation, heightened anxiety. And we know that poverty and social exclusions were already a huge issue affecting many individuals. And this pandemic has resulted in seeing many of our families and children who don't even have the basic essentials for themselves. We know there's been an increase in levels of domestic violence since the lockdown. Substance misuse and alcohol issues have been exacerbated in several households, and indeed for those who are already dependent on these. So it's vitally important that we understand the circumstances of our service users and their families. We need to consider the potential strengths and vulnerabilities that exist for our service users and their families where possible. We need to find out which other agencies are involved with them, and we need to work in partnership with these agencies to ensure we're working towards positive outcomes where appropriate. This information will inform our understanding of our service users' assessment, formulation of care plans and discharge plans. So again, it's very important that this information is also reflected in our service users' records.
Okay, thank you, Arvi. Kath, I was going to ask you about early help and looking for opportunities to provide early help. Do you think that's changed in any way because of the pandemic?
I think it has. The early help offer is changed actually. It's expanded during the COVID-19 period. So we've got more partnership offers in some respects, but I think it's probably best to start off with explaining what early help is, just a quick reminder. So early help is when you've got families that need some support other than the normal universal support that they get from schools, etc., but they don't meet a threshold for a statutory safeguarding intervention. So it's vital that we look for that when we're doing our assessments, and clearly those have been impacted upon by the fact that we're doing more virtual assessments, and so are social workers and so are others. So it means that we have to work in partnership, which is the second key top tip, I suppose, for early help. Early help is all about working in partnership. So if you happen to see a service user whose child you're a little bit concerned about, maybe you can contact the social worker and say so afterwards, or if you see them in the background of one of your video calls, you can tell the social worker that you can see that they're okay. So those are the kind of things that you need to be thinking about early help at the moment. Again, another top tip is something that you already know. So you know your caseloads, you know those people that were perhaps teetering on the brink of needing some help. So those might be the ones you want to take special attention to when you are contacting them. And for any more information about the changes to early help and what's available, you can look on the COVID-19 pages, the safeguarding pages on Connect, or have a conversation with us and we can let you know a little bit more about those.
Okay, thanks, Kath. It's interesting talking about knowing your caseload, and And I was interested particularly in knowing about additional vulnerabilities, Arvi, that may exist within your caseload.
Absolutely. As I mentioned previously, it is important for us to consider the potential vulnerabilities of our service users in order to ensure we understand their needs, any risks that they may be facing, and how we can best support them. Some of our service users will have additional vulnerabilities, which will or can potentially impact on their level of capacity in understanding the social distancing measures during the lockdown. For example, if someone has a learning disability or autism, they may process information differently or require different levels of support or environmental conditions to communicate their needs or concerns. So the enforced lockdown measures and staying safe in general may cause great emotional distress to them. Therefore, supporting teams will need to consider safe ways to explore this with these individuals and, where appropriate, with their carers as well, to understand how best to respond to the needs. Many within this group may be more at risk of group. So where possible, we need to understand their normal presentation. And when this alters drastically, it could be an indicator of concerns that requires additional support. This, of course, also applies to those groups of individuals with impaired capacity, as those with forms of dementia and some of our service users with mental illness. So in understanding the vulnerabilities of this group and how we might support them, it is doubly important during these times to consider their carers if they have them. We must keep talking to them and trying to understand the additional pressures they may be facing and what other potential avenues of support are available to them. And from my perspective as a named nurse for safeguarding children, I would also like to highlight the need to understand our children and young people as being potentially vulnerable during these present circumstances. For example, we know that children are going to be going online, going to be accessing online activities, and this could potentially place them at risk of exploitation. So it is important that we understand the lived experience of children of our service users, or if they are service users themselves within our trust.
Thank you, Arvi. And then thinking about engaging with our service users and patients across the trust, there's some unique challenges there in terms of the ways that we're doing that now, Kath.
Yes, because of remote working and social distancing, a lot of us are working and using digital options, so video conferencing, phone calls, etc. That's not just us, that's our partners, the police, specialist services like domestic abuse services and social workers. And it really alters the way in which we interact with our service users. So it's much more difficult, for instance, now to judge home environments because we're not doing the home visits that we did. The way people are, in consultations, their body language, their personal interactions, they're much more nuanced, and it's quite hard to tell those over video calls, and absolutely impossible with phone calls, really. And I suppose what I really want to stress is safety, and Arvi has mentioned domestic abuse. So we really need to say that domestic abuse, you're all aware, has gone through the roof. Calls out to the National Domestic Abuse Helpline have quadrupled, I think, during the time that we've been locked down. We've had 14 deaths of women and 2 deaths of children related to abuse. Our normal practice of seeing people alone to give them the opportunity to disclose anything risky is not there anymore. So when we are having those consultations, we really have to be considerate about who's in the background, what the impact might be upon people of the conversations that we're having. Again, I know I keep saying this, but knowing your caseload is really important. You are going to have people that you already know are subjected to domestic abuse, and you may already have safety plans with those. So if you have, use those safe words that can mean that you can curtail, your consultation if you think it's becoming too risky for somebody. You also need to think that as much as it's really positive to have digital options and we're able to reach out to people through them, they've also got potential negative consequences for some. So people can be recorded and listened to, and that can be exploitative potentially. So we really have to think about that as well. There is some guidance about video consultations and phone consultations on the COVID-19 pages again. And obviously, if in doubt, reach out to the safeguarding team and we can talk to you.
Great. Well, thank you both. That's brought us to the end of this briefing today. We're hoping that everybody finds that useful. Some really important ideas for us all to take on board there. Just to signpost you all to our COVID-19 pages on Connect, you can find an accompanying resource, which is a 7-minute briefing on that page. With some ideas again about safeguarding during the pandemic, and this video will be there and available to colleagues who haven't seen it in the original rollout. So I guess the message is, Kath's first message, safeguarding is business as usual. Please do contact us if you're stuck. Thank you everybody, and goodbye.
Thank you.
Thank you.
Bye.
Bye.